Hello, everyone. Thank you so much for joining this HIV 50 plus strong and healthy webinar. I am super excited for having this conversation with you all. It's about our LMS system that you will learn more about. So again, thank you for joining us. Today, I am super excited to be joined by two amazing colleagues, subject matter experts. You will hear what they have to say regarding the components of the LMS system, the topics, and also the the backend or the platform itself. And first, before we continue, I wanted to introduce Bridget. Bridget is part of the HIV 50 plus strong and healthy program. She's also a licensed vocational and certified AIDS care nurse in Palm Springs, California. She works in the Well Project as a stakeholder liaison, representing the interests of women living with and affected by HIV. And with us, we also have MSJ. He is the Public Health Program Associate and Community Engagement Lead. He has a background in psychology and also he completed a master's in public health. He is a professor, researcher. He has done research on HIV stigma and is very knowledgeable on sexual health. And he's actually the person that built the LMS system, work hand in hand with us to make it look as good as it looks. And he will be talking about the platform in itself, how you can navigate it. If you have any questions, please use the chat box. Taylor, who is in the background, Taylor is from the communications team. She will be reading your questions aloud. Now I am going to share my screen real quick um, to show you to talk a little bit about to provide a little bit of context of how the LMS system came to be. Give me a second while I share my screen. Okay. Hopefully you can see my screen. Taylor, tell me if not.
Nope, you're
Again,
good.
perfect. Thank you so much. Again, thank you everyone for joining us for this webinar about educating ourselves and our peers. This is NMAC HIV 50 Plus Community Education Project. Before we continue, I always like to start our webinars to letting you folks know that NMAC is a partner of the CDC, particularly the Let's Stop HIV Together campaign. And in this campaign, you can find different resources about stigma, testing, prevention, treatment, and care. And you can find social media kits that can help you start conversations about HIV in any of these topics. And as you can see from the pictures that we have on screen, some of them have been part of the 50 plus program, like Portia, like Brian. So we are excited and happy to be able to support the CDC in expanding this campaign that really reflects our diversity. On screen, you can find a link to the campaign. We're also going to post it on the chat so you can access all of the resources for the Let's Stop HIV Together campaign and also the services locator. It's a great way, once you access the website, it's a great way to find services around you based on your zip code. Okay, now so the agenda for today, we are going to, I'm going to introduce the peer education project. Bridget is going to be talking about the course structure and the role of peer educator. And at the end, MSJ, we will be talking about how to navigate the platform, and then we will open it up for a Q&A. These are our amazing presenters that I introduce. Um, Again, for those that don't necessarily know the HIV 50 plus strong and healthy program, so the goal of this program that has been running for about 4 years for 4 years is to engage and foster leadership among 50 plus individuals living with HIV. And we do that through social networking, increasing health literacy, and facilitating peer-to-peer trainings, advocacy trainings, and social media campaigns. Because what we are really looking for with the HIV 50 plus strong and healthy program is to be able to provide the tools for effective advocacy, and for to increase the reach of the voices of people living with HIV who are 50 plus, and to be able to not only identify their needs, but then once those needs are identified, be able to strategize and build a path forward for action. The objectives of our program essentially is to build community. We know that isolation is one of the biggest barriers for people living with HIV who are 50 plus. So we really want to build a community here that you can interact through social media, in our conferences, and through different trainings that we provide. Obviously, increase awareness and education, which is one of the fields where the LMS or the peer education program falls, and is to develop awareness and educate about prevention and management of comorbidities. And as you will see in the LMS system, is all about healthy living, and also one of the main several of the principal comorbidities related to HIV 50 plus people. And also, we have trainings in the LMS that are specific about leadership and advocacy, where we explore the history of advocacy, how it looks now, and how folks can take action. And again, here you can see the different components of the LMS system. This is just a brief snapshot of what you will find on the system on the platform. The first one being policy and advocacy. We also have cardiovascular health, diabetes, hand or HIV associated neurocognitive disorder, healthy living, and mental health. Those are the 6 courses that you will find on the platform that once you complete them, you can receive a certificate to let your colleagues in your work, other advocates, to let them know that you have completed this course on these particular topics. And now I will pass it over to Bridget, who will be talking about the different curriculums. And she was also one of the trainer. You will find her amazing videos on the platform. So she will be discussing the important role of of having peers educating others. So Bridget, take it away.
Perfect. Thank you so much, Damian. I appreciate it. And thank you for having me here today. Just to kind of start out, thank all of you for showing up. I'm a fan of saying that when we show up for ourselves, we show up for other folks. And it's important that we continue to show up for each other in all of the ways that we can, particularly to kind of reduce some of that isolation and loneliness that Damian was talking about before. So let's go ahead and jump into the course structure, kind of why we were the folks doing the education as peer educators. And we'll talk a little bit about the themes that are covered in the LMS and why those themes are important to those of us that are aging with HIV. I may not look it, but I'll be 52 this year, and I definitely am feeling the aging aspect of living with this virus. So let's hop ahead to the next slide if we can. So the first thing that we covered in the LMS, which is the learning management system, is policy and advocacy. And I bet many of you who were in from the very beginning know why policy and advocacy is so important, and why we definitely need to use our voices in this arena and these aspects. So the thematic areas specifically for the policy and advocacy, we're defining advocacy, our history as a movement, the examples of activism, meeting our needs as we kind of evolve and move forward, taking action at the national level, and then what our next steps should be. I think it's really important that not only for those who have been living with HIV for a long time and are longtime survivors, but I think it's important for the folks who are coming up behind us, who may be 40, but are starting to lead into that aging kind of category. We need to know where we came from in order to have a clear path for where we should be going. And I know sometimes for those of us that do the work, it feels like we say the same things over and over and over again, but we have to, right? It's important to do that because there are new folks, unfortunately, being diagnosed who do need a path and who do need to kind of know the way. Next slide. So the big one, cardiovascular disease, right? So we know that HIV has a definite effect on cardiovascular health. It is the HIV itself, and it is also the medications that we take sometimes that have an effect on our cardiovascular health. So the thematic areas that we cover in this training are basic facts about what cardiovascular disease are, how they interact, how one affects the other, the things that you can do for prevention of heart disease to try to kind of stop it before it starts, treatment options for mitigating circumstances should they arise and you are having problems with heart disease, and then also ways to stay healthy. And one of the things that I like about this program so much is that whether or not you are a novice or somewhere in the middle, or you are in the medical field, it gives us as individuals and advocates a way to be able to take these things to our clinicians and our providers to make sure that our questions get answered, right? Maybe you don't know what questions to ask. This training can help give you a starting point, which I think is amazing. Next slide. And then there's diabetes. So diabetes is particularly important in communities of color. We know that it affects us more so than some other groups of folks. And the reality is that diabetes can be a serious condition to live with. It comes with complications. There's a lot to learn with the diabetes diagnosis. It's kind of readjusting lifestyle, which I think for some folks may be a little bit triggering because we already had to readjust to living with the virus, right? But some of the basic things that are covered in this particular training are basic facts about what diabetes are. Again, how HIV and diabetes react, what happens if you're living with both. Prevention, of course, treatment options, and then again, ways to stay healthy. I can tell you as a nurse, the best way to stay healthy with diabetes is not to acquire diabetes. And so pay attention to your diet and get some exercise. It's not just good for your body, but it's also good for your spirit. But again, hints and things that you can take to your clinician to maybe have a conversation, start the conversation, or even to help you. I know sometimes for me as a nurse, I have patients that are very stubborn and don't want to hear it. And maybe you have family or friends or peers who are very stubborn about what diabetes is and how it can potentially impact their lives. And so this is a starting point. Next slide. And so I don't know if any of you or how many of you may have heard of HAND. It's HIV associated neurocognitive disease. It's different than dementia. It is different than Alzheimer's, but it is something that does happen. And I want to point out at this point right now that the idea of these courses are not to scare or intimidate anybody. It's for knowledge. Knowledge is power. When you know better, you can do better. And so, HAND is one of those things that absolutely requires conversation and diagnosis through a clinician. But if you've never heard of it, this is a great introduction to it. So, themes that are covered in the HAND portion of LMS are basic facts about what HIV associated neurocognitive disorder are. There are ways of prevention, there's treatment options, and again, staying healthy. One of the things that I really loved about doing this particular course is that it gives you some very practical ways to recognize what HAND may be, and how to, again, have that starting point for these conversations that you may need to have. Next slide. And so, healthy living. I mean, how important is that? So, overall, I think in the very beginning, a lot of times when we're diagnosed, we want to do everything right because we want to stay healthy. And then as we recognize that it is a chronic condition, like many chronic conditions, some of us get lazy and we forget to do the things that we're supposed to do in order to live the most healthy life that we can. I am guilty of that myself. So I know that it happens because I'm doing it myself. So thematic areas covered here are experiences, right? Environments. How does the environment that you live in affect your health? Because it absolutely does. Your body, the way that your body changes, things that you can be doing to help your body out. And your body is one of your most valuable assets, if not the most valuable asset that you have. And so we need to take care of it. And then probably the most important thing to me is mental health. We all know that mental health is not just an issue; it's a little bit of a crisis in many places in the country. So mental health is incredibly, incredibly important. I hope that all of you, as you're on this call, are finding ways to take care of your mental health, to care for your mental health, to get help if you need it. And again, we have a starting point here, a jumping off point, things that you can use, tools in your toolkit. All of these are tools in your toolkit to help you thrive with HIV and live healthy as we continue to age, because we can't stop time. And right now, we don't have a cure, but we do have a way to kind of pause some of the effects that the virus has on our bodies through taking our medications. And so I think all of these have a little bit of um, it's a little bit of a medication for your mind and your body and your soul as we navigate life with HIV. The next slide, I think, is that it? So yeah, specifically on mental health, which we were just talking about. And so in the mental health course itself, there are the basic facts about mental health, health and HIV and mental health prevention, treatment options, and staying healthy. So I'm sure you're seeing by now that there's a theme for all of these, right? We're not just throwing information at you. We want you to have the information. We want you to know how to apply the information to things that you may have going on in your life. And then we also want to give you some options for how to treat or move forward if any of these conditions or things are affecting you. And so it's really important that we stay focused on, I think, kind of our overall again, like I said, mind, body, and soul. I think that's the best way to put it. I don't want to change that, mind, body, and soul. And these courses are a way to help get you in that mindset. I love the fact that there's a certification at the end because you have something in hand um, that not only shows that you are advocating for yourself, but that you're ready to advocate for others as well. Next slide.
That would be the last slide. You
Okay.
cover all of the trainings, but before we go with Michael, who will actually provide the viewers how to navigate the platform, since you were one of the trainers. I would like to hear your thoughts about first your experience, but also I'm a strong believer of the importance of trusted messengers. And that's what we are looking for with this project. So I wanted to hear your thoughts on that, on those two topics, your experience and also the importance of trusted messengers.
Absolutely. I loved the opportunity to do this. I like opportunities to work with NMAC, especially when it comes to things around aging, because I think often we feel left behind or ignored as we age with HIV. And for me, there is absolutely nothing like being in community and around other people, right? Because we all understand each other. Our stories are all different. The way that we approach life with HIV are it's all different. But the fact that when we get together in one space, no matter what our background is, we laugh, we joke, we have a good time. We are able to identify with each other, and so that was one of the things that I really loved about filming the courses. It was super neat and kind of cool to be in front of a camera and do it, right? Like just from a personal experience. It's different reading things from a teleprompter than it is
Yeah,
from like looking at slides. And
yeah,
so it makes you feel a little bit like a movie star, which was
yeah,
super fun.
yeah,
The other trainers are folks that I'm familiar with in the community, right? Like I've seen work that they've done, I've seen them on webinars. But it's very different to actually be in the same space. And I think that that ties into why it's so important to have trusted messengers, right? I'm more likely to identify with and believe someone that I know has my experience.
mhm,
Um, as a nurse, I'm always like I lecture patients, right? I'm following your plan of care. But if I don't have a relationship with them, they're less likely to want to follow that plan of care. Same things with, when it comes to clinicians and having these conversations. I want to feel like I'm being listened to and like I'm being understood. When I'm
mhm,
not a nurse, I'm a patient, right? I'm someone's patient. I went to the doctor today and I have that identity with my clinician because we're able to talk to each other and see each other. And so these programs, when we are able to do things like this, only highlights the importance of a being able to see and be seen. B, having the knowledge and information that's so important to be able to make sound decisions. And then C, um, having that sense of trust, right? Just being in community. There's something about being in a place that is stigma free, not having to worry about what the next person thinks about you because they already, right, we're in the same place. And so that's why this was such a great experience and why I think it's definitely one of those things that I would say each one teach one. If you are a person that leaves after this webinar and goes and takes the course, tell somebody about it so that they can do that and so that they can kind of have that experience. So that would be my answer to that. And I hope it wasn't too long-winded, but I'm excited about it. I think it's a great program.
and I'm happy to hear that because in other programs that we have, or at least thinking about the Women of Color Fellowship, which is one of our other programs here at the treatment division, I do understand the importance of talking to people that really understand where you're coming from, that really have similar experiences to you, and there's just an understanding, and that elevates and puts makes for a stronger message. And I think that identifying trusted messengers like you, people that the community really trusts, is important. And we have seen that in when we were working the response to mpox. We saw that through COVID, having people out there that not only are subject matter experts, but really know the struggles, know the community, and that the community can see themselves reflected. So thank you so much for that for that
Absolutely. And
background.
just one more thing, real quickly, because it made me think about it while you were talking. When we understand and have when we have the facts as a trusted messenger and we can deliver that to someone else, it actually gives them more confidence to be able to step out and face stigma from other people, which I think is important, right? A lot of stigma is born out of ignorance and not knowing. And so when we have the tools that we need to be able to educate folks, it is a tool against stigma. So, yeah, thank you for the
Yeah,
opportunity again.
no, of course. Thank you so much. And now I'm going to pass it over to MSJ, who will help us in navigating the platform. Take it away, Michael.
Thank you, Damian. Listen, I am like super excited to really walk through this platform. And I have to first thank Damian and the Trooping Division for allowing me to be here. And as you can see on my face, I'm super excited because I think Damian and Bridget have like beautifully outlined what's included in this platform, its importance, the significance, and how much effort has really been poured into this. And I think when I say I'm so excited, I really can break it down into like really two different themes, if I will, right? Is that first thing is like it's super informative, right? The information is engaging, and Bridget really highlighted it's like it's empowering for a community, and I'm super excited about that. But the second thing is, if you really think about our experiences working in this field, or just working in general, we probably all had to like take some type of required course online. And if you think back on most of those courses, they probably like very boring, and you may have been thinking, like, okay, how long is this? How long is it going to take to finish this? But the beautiful thing about this platform and this software and these recordings is that it's super engaging and the trainers are amazing. I remember being in DC when they were recording the different trainings, and I was sitting back and I was like, oh, this is good. I remember saying, like, because the trainers, they literally, the peer educators, they make the information come alive. They're culturally responsive, the lived experience, everything comes together in like this pot of soup, if you will, right? And the aroma just starts to come up. So I'm super excited to really share what you may experience while being on the platform. So I'm going to share a screen. Let's take a look at what's on there. And Taylor, it seems like I'm unable to share screen at this moment. Oh,
It
there we go.
should be fixed now. There you go.
Thank you so much. All right. So immediately when you are on the website, and you'll be provided this website link, so you don't have to write it down right now, but this is the page you'll see. This is the home page. You can see my cursor here going to the right. You would simply click on courses. You don't have to log in, don't have to hit any of the other icons such as contact or the Instagram or those icons there. You just hit courses. Once you hit courses, you're immediately going to see the HIV 50 plus community education project. When you click on this, you're taken to the actual course online, and immediately you receive a warm welcome here by some of the team members as well, and you get a chance to really get a summary of what to expect and what's to come within the platform. I'm not going to press play because I don't want to tease you, because I would have to pause it for the sake of time. But let me just say this: it's worth looking at, and I'm going to let that keep on being there and not play it so you can look forward to seeing something. All right, but let's just scroll down. So the first thing I want you to do when you log in is immediately press play on the welcome message. I promise you, it'll set the tone for what to expect. But as you scroll down, you begin to see those different modules or courses or topics, rather, that Bridget talked about: policy and advocacy, cardiovascular health, diabetes, hand, healthy living, mental health. Let's click on a few of them just to kind of show you what's going to be shown in these different modules. So let's click on cardiovascular health for just an example. Within cardiovascular health, immediately you have different parts, different videos. They're not too long, but super informative, right? The beauty of this is that you're able to pause them, you're able to stop them when you want. And you have part one, part two, and different modules have, maybe three or four parts, but you'll see when you go through those different modules. But I think the beauty of this platform also is that if you look to the right of the video, you're able to click on the actual presentation and download it, right? So if you're anything like me, I love to take notes as people are talking. So being able to download this file allows you to be able to print it, or if you want to take notes on your computer, you're able to do that while the video is playing. But after you get finished watching the different videos, at the very end, you will see a quiz. Now, don't worry, this quiz is not to like intimidate you or to be graded, but it's really to help you check your understanding. So when you answer different questions, whatever choice you pick, whether it's true or false, if it's true, if it's the correct answer, it's going to tell you why it's true, why it's the correct answer. If you select the wrong answer, it's also going to give you tips, right? Some feedback on maybe how you may have not gotten to the right answer, and you're able to retake this quiz as many times as you want, right? So it's really more so a knowledge check, right? And then after completing any of the modules, you're also able to look at some additional resources. The treatment division has also drafted up here, not drafted, finalized here, some different resources from the American Heart Association. I think here we're talking about cardiovascular health, right? So you're able to click on different links. You can download this document and save it for future use, or you can actually just click on the links, the hyperlinks here, to take you to these different resources. And so some of the different resources here you see, the American Heart Association, the CDC Heart Disease Prevention, smoking and HIV, so forth and so forth. Let's go back out to the different modules, pick the course, and let's see another one. Let's see, which one will we pick? Let's go with, let's say, healthy living. Same format, right? You have your videos that you get to watch. You can pause and play them at any time. In this particular module, you have four parts. So there's four videos, right? And again, for all of these videos, you also have the presentation right on the right side here where you're able to download, follow along with the video, take notes, print them out, whatever you see fit. And again, at the end, you're able to take that quiz, just a little knowledge check. And like I said, no matter what answer choice you pick, you're able to get feedback and extra knowledge to really assist you on your learning process. And again, have that training resource. And so you can see here that a lot of time has been put in by treatment to really compound so many resources that you can take beyond this training as well. And so once you've completed, I'm gonna go back to the main page here that has all of the courses, all the topics here. Once you've complete each of these, right, 1 through 6, you also get a certificate, like Bridget and Damayan said, that really shows, hey, something tangible that like I've completed this course, a certification that really highlights the work that you've done. And so, of course, within the introduction video as well, there's going to be an email stated. If you have any questions or concerns or need help navigating, we're always welcome. You're always welcome to email us, and we'll be gladly to assist you and help you navigate this platform as well. Back to you, Damian.
Awesome. Thank you so, so much, for helping us to better understand and navigate the platform. Now, I would like to open up the discussion for questions. If you have any questions, please put them on the chat. Taylor will read them out loud. And then, but I think that Michael gave us a really good overview. It's a platform that is really simple to use. And once you complete all of the um, curriculums, you get the certificate. Are there any questions, Taylor?
Yes, so we have our first question from Yolanda, who asks, can you give us some examples of what the symptoms are for hand?
Would you like to come back on screen, Bridget? Bridget and Michael, please, both of you
Yeah,
come
I
up.
was waiting
Sorry.
for my my camera to load. It's a good question. And so the symptoms of hand often show up kind of in the same ways that the ones for dementia do a little bit, which is why I mentioned it, and that it is slightly different. So some forgetfulness. There may be some neurologic kind of issues, so motor skills, fine motor skills. It's really, really important to note that different things can affect mental health and your cognitive abilities. And that's kind of discussed during that particular module. And so it's really important for me to say that as you watch the course and you start to see what some of the symptoms are, if you're experiencing them, it's important not to leap to the conclusion that, oh my God, I have hand, right? It's why I stress that it's a conversation that you should have with your clinician because medications can cause some of those symptoms. To be honest with you, a UTI, an untreated UTI, can cause some of those symptoms. And so I would say as you watch the course, if you recognize some of the things that you see, again, schedule that appointment with the clinician to talk to the clinician. I hope that answers your question. The symptoms vary from person to person. There's a wide range of them. And so it's important to be aware, but not to be fearful, if that makes sense. It is something that commonly happens with HIV because of the nature of HIV. Untreated HIV can cause it more so. And so that's one of the reasons that it's important to take your medications as directed as often as possible. I don't lecture about adherence because life happens. So just keep that in mind as you move forward. I hope that answered your question. I can't see you, so I hope it answered your question.
And I think you're bringing a really important point about about the motivation of this project, that is to be able to provide folks with information so that they can advocate for themselves and bring up these conversations with their doctors. Sadly, not many providers know about HIV and aging. So I believe that we are at a point where it is up to people living with HIV to kind of put that that advocate hat, and talking to the doctors and talking to their peers and sharing this information as much as possible.
Yeah, I absolutely agree. And I agree on a couple of levels. One is because, shamefully, I think HIV is still considered very much a specialty disease, right? And as long as it's been around and as many people as are living with it, it should be more of a streamlined primary care kind of focus. But the fact is that it's still a specialty. And the other fact is that as we age with HIV and hit that 50, 60 year old mark, we're lacking in geriatric providers and all over the country, right? And so the more you know, the better you are able to advocate for yourself and to be there for your community. And so Programs like these, again, give you that starting point to be able to take to, even if it's not your HIV care clinician, to a primary care physician and say, hey, I'm feeling this and this and this. Can we talk about it? And it's okay to tell a clinician, if they say, well, I don't know anything about it and I want to refer you, it's okay to say, well, could you find out so that the next time we can have this conversation, right? You can encourage folks to educate themselves. Because when you advocate for yourself, you are advocating for the next patient that comes through. So, great question.
Absolutely true. Awesome. Taylor, are there
Before we
any
move on
questions
from
for?
that,
Yes. Yeah.
before we move on, yeah, we had a follow-up question. Somebody's looking for video content on hand as well. Is there any type of video resource that could potentially be shared following the webinar?
As far as places that they can go for hand or just the general courses?
For a hand specifically.
So I'm always careful when I suggest this to people. Um, you can search on the web for other information regarding specifically regarding hand. Things that I always caution people to look for if you're going to do a search for something, whatever the topic is, no matter what it is, but particularly when it comes to medical information. You want to check the date of when the information was released, because sometimes when you search things, it may be a study that was done in 2017 and it may be well outdated by now in 2024, even though that's a short period of time. So you want to be careful about the date. You want to make sure that the resource that you're using is a reputable resource. So, for example, WebMD, while it's great, is not always the best information. And so use search engines to give you a starting point, but always take the information that you gain to a professional. So there's other information about all of the topics, but there is other information about hand. Um, the person that you most want to talk to about this is going to be a neurologist, in conjunction with an HIV specialist. The two will go hand in hand. It'll be a referral kind of situation, most likely.
Thank you.
And also remember that when you access the platform and download the presentation, the last slide also has additional resources.
Awesome. Okay, so um, our next question, directly relating to the courses, is will closed captioning be available on the course videos to improve accessibility?
Yes, it is. Like it is closed captioning in both English and Spanish, so you're able to toggle your video to have closed captioning either in English and or Spanish.
How can people do that, Michael?
Yeah, maybe I should share screen again and show that.
Yeah.
I was trying to keep the videos away from the people, to keep it like a little suspense there. But I'm gonna show that for sure. Give me just a second here, and I will pull up one of them. Okay, Damian, we may be having a technical difficulty with the closed captions right now.
Oh, maybe we can check.
I'll check on that for sure, but I do know it is a function, right? And and of course, if you do have any issues with getting them activated on your screen, definitely send an email and we can assist with that. But right now, it is having an issue coming up.
Hmm.
I
I think
apologize.
I know it
I
does
saw
work
the
because when I did the
yeah,
courses, it was working. It worked
right.
for me when I did it because we
Oh.
initially went through and did a run through. It was really weird to watch myself on screen. I don't always love the sound of my own voice to hear it, but
it
nonetheless,
ha-
it definitely
it
was working
happens.
when I did them.
It happens to all of us. But thank you for that question. We will look into it. Thank you so much. Um, yeah, we'll get that fixed. Any other questions, Taylor?
Yeah, we have quite a few, so I'm hoping we're able to get them all in before we wrap up. So, Kevin Sitter asked, will you be adding any topics such as how to work with transitional care or long-term care facilities?
So we are looking into adding more modules, but this is at this moment this is kind of our pilot to see how this the peer education project works to improve things so that once we do it in the future, it's kind of the improved version of the LMS system. But thank you for that suggestion. Please keep them coming because we will be expanding the curriculums.
Okay, thank you, Damian. I am getting to the next one. Please explain how this will assist the National HIV and Aging Network uh, Trainer for Trainers Work Group, prov- how this will assist the NAN Trainers Group provide peer education in their communities.
Yes, no, definitely. So the NAN is the National HIV Aging Advocacy Network, and this is also kind of an extension, particularly the one on policy and advocacy. So one of the things that we have done is to, as Michael was showing, that you can download the full presentation so that you can either use it as a conversation starter with some of your peers, but also at the beginning, the presentations were done either in person or gathering a group of people. We know that that's still a really important thing because with a person you can interact, you can ask follow-up questions, you can build relationships versus with the videos. Obviously, you cannot, but at the same time, you have the opportunity to do it at your own pace. So this project will definitely help expand NAN's peer education um, advocacy and efforts.
Um, Another, it's not a hand question, but somebody mentioned that if you go to Google Scholar, there are articles available about hand, and if you just, type it in the Google search, it'll bring up some academic articles. So somebody just wanted to share that information. Um, our next question. Can you complete the modules without downloading them? Because bandwidth or storage capacity may be an issue.
Absolutely. The download is an optional resource, but you do not have to do that.
That's more of a like an extra. Once you complete or as you are doing the navigating the courses, you can have it like side by side or keep it for your records for later.
One of the other good things about the course as you're taking them, if you do kind of create account and log in as you're going through, let's say you start watching it and somebody knocks on your door and you step away, when you log back in, it'll ask you if you want to continue from where you left off or start at the beginning again. So it's very user friendly and also makes it really convenient for you to have a life while you're trying to do it without losing track of where you are.
Thank you. Okay. So. We have a question. Not everyone has access to a computer. Is it set up to work on cell phones?
You,
You're
yeah,
muted.
you're muted.
Yes, you should be able to also log in on any mobile device and also access this course as well using the same website link for a desktop computer or laptop.
It's just a little bit different, but it's easy to navigate also. It's very similar to what Michael showed.
Okay. Someone has asked, once we've completed the modules, where can we go next for more training models?
That is a great question. In the again on the on the um, on each presentation, you will find different resources, but also you can right in the beginning of the homepage of the LMS system. There's a link to our Facebook page where you can engage. We have a group where you can engage with other people living with HIV who are 50 plus, and there we also post every training opportunity that we have, any updates for the 50 plus program. So that's also another way where you can engage with your peers and also learn more about the work that we're doing in the treatment division.
And then I'm gonna go back to a question. Someone asked, is there basically a list of required topics? And I think they might follow up with one of y'all directly on this, but is there a list of required topics that have to be completed for attending the conference, maintaining 50 plus status current, and becoming a trainer presenter? So I think they're trying to ask about staying active so that they can become present on these modules as well.
Yeah, I think that question relates to the members of the present cohort of the HIV 50 plus strong and healthy. Yes, you would have to complete all of the 6 modules as yes, a requirement of the program.
Okay. I think that's all questions for now. If you all have any more questions, you have about 5 minutes left. You want to drop anything else in there right now?
I love that everybody's asking these questions. They're good questions and they're involved questions, which is what I really love. And I say use the momentum that you have. Like if you want to continue to see this kind of thing, use the platform. Encourage folks to use the platform so that the interest is there, the activity is there, so that things like this can continue to be developed. Because like the previous question shows, there are tons of topics that could be covered as they relate to aging and HIV. And I think us staying as informed as we can is the way forward and the path forward, because you never know what's going to happen, politically or otherwise, funding or otherwise. And the more you know, the better off we are, and the better able we are to continue to thrive, and live healthily throughout the rest of our lifespan, until there's a cure, because there's one coming. I refuse to believe anything different.
Thank you. And Bridget, Paul Aguilar just made a comment. It's not a question, but a comment saying that you're doing a great job. Um, so,
Thank you.
She
Thank you.
um,
is. She is.
I think the last question I'm able to see, unless anybody has any last minute questions, is can you post the link or the website for the courses?
I don't have access to the chat, but also Damian, Will there be this website link posted on the website, treatment's website as well? So yeah, so people able to go on the
Yep.
website. Oh, I do have access to the chat now. Just a second.
But is tavuri.edmac.io.
And I just posted it in the chat as well.
Awesome. Great. Well, thank you everyone so much. And again, if your questions were not answered today, please send us a message. Send a message to treatment at nmac.org. We are here to help you. If you find any type of challenges as you navigate the platform, we are here to help you, to support you. And keep those recommendations, those suggestions coming about what the next topics should be. We really would like to hear from the community what are the other curriculums that you would like to see. And thank you so much to Bridget, to Michael. Thank you for your expertise, for your time, for your kindness. Thank you both so much, and I really enjoy working with you. So I hope this is just one project and that more will come. Well,
Thank you
thank you.
so much. I appreciate it. Thank you. Thank you.
Thank you. Awesome. Thank you all so much, and we'll talk. Bye.
Have a good one.
Thank you, Taylor.